qualify for hospice, people need to be certified as terminally ill. And what that means is that two physicians need to say, in my opinion, if this disease progresses in the way that it is expected, I would not be surprised if this person died in the next 6 months. Talking about death is always hard, but that's the definition of hospice eligibility, according to Medicare. What's hard, I think, about hospice is that most people don't get referred to hospice when they still have 6 months left to live. Sadly, referrals for hospice often come very late when people are in the very last days of their life. And so it creates a self-fulfilling prophecy that when you go on hospice, you die very quickly. That's not about what hospice is doing. It's about the fact that people get referred very, very late. And that's unfortunate because hospice can be very, very helpful. Hospice, again, is part of most people's insurance benefits. And once you've been deemed as eligible by saying, okay, this person only has 6 months or less to live, if we expect that, then you get a tremendous amount of services that are covered by your insurance benefit. You get nurses, you get a physician, you get hospice aides, you get medications, you get hospital beds and oxygen and all supplies that you might need to help manage your illness wherever it is that you live. That can be at your home, that could be in a hospital if that's where you need hospice. It can be in an inpatient hospice center like the Hulatar Center that we have here. It can be in a nursing home. We even cared for people who are homeless by finding places to meet them and care for them as they approach the end of their life. It can be a tremendously beneficial program. And really importantly, one of the most important aspects of hospice care is bereavement care. People get, if their loved ones die on hospice, people have access to 13 months of free bereavement support from the hospice who cared for them. Where else in our healthcare do you get free mental health services? It's pretty astonishing. So it's an amazing care for people who truly are at the end stage of a serious illness, where the priorities are to focus on comfort and quality of life and to not continue to try to cure or eradicate the illness. Palliative care actually is a very large word that encompasses a lot of that. And to be honest, hospice care is a very subspecialized part of palliative care, where the illness is deemed terminal and the focus turns to comfort. But palliative care can be helpful much upstream, and I think that is another place where there are a lot of myths and misconceptions. Palliative care is for people who are living with a serious illness, not a terminal illness necessarily. So what would count as a serious illness? Heart failure, COPD, dementia. A lot of different diseases would qualify somebody for palliative care. And the goal of palliative care is to provide that additional support, right? The word is to cloak, to cover, and to help. And we are there to help and to support while somebody may still be seeking some curative therapies for the serious illness. So the good news about palliative care is that people don't have to prioritize only comfort. When you sign on to hospice, you're saying, I'm not going to get any more curative treatment. I'm going to focus on comfort and I'm going to get all of this added support. People can have access to palliative care while they're still doing all of those curative things, while they're still going back and forth to the hospital to manage the exacerbations of their heart failure or their COPD, while they're still on dialysis with their end-stage renal disease, while they're still getting cancer-directed therapy if they have a cancer. And the palliative care team, when it's doing its job, is there to help with managing that illness. Not with curing the illness, that's the oncologist's job, that's the pulmonologist's job. We are there to help control symptoms, to help manage things like pain and shortness of breath. We're there to help plan ahead, to have those conversations of what does this look like now? What might this look like 3 months from now? And what are your priorities with this illness as your situation changes?